Hey, Russell here from Adelaide West Physio and Pilates. One question that comes up from time to time regarding GLAD is, so I've had a hip or a knee replacement done, is it suitable for me to do the program? Is there any benefit to it? And the short answer is absolutely there is, because what you'll find at the end of that program is you'll be stronger and you'll be more confident with the practical things that you do in your day as well, like steps, going up and down steps, even things like getting up and down off the floor if that's what you're at that stage of your rehab. They're the kind of things you'll get a chance to practice too, but your strength and your balance and all those things are going to be so much better at the end of 6 weeks, and start off a habit and start off something that you can continue with. And it doesn't mean that that's your limit at the end of 6 weeks either. You could improve well beyond that. But the point is that you can certainly optimize your function after a hip and a knee replacement done. And speaking from experience as someone that worked in a public hospital, and I don't know how it operates these days, but I know back then there was very much a sense of, particularly after hip replacements, you've had your hip replacement, here are your exercises, go away and do it, you'll be fine. And there wasn't any kind of follow-up, really scheduled or optimizing and really helping people to get back to their ideal function. And the risk, I suppose, of stopping and not completing that process is that you can be left with weakness that affects your gait pattern, that affects your ability to do some of the things that you enjoy doing in life, your ability to go up and down stairs, your ability to get up and down off the floor. So even though you've hopefully had the pain relief from the joint replacement, that functionally you're not nearly as good as you could be. So I think that's one of the things about GLAD that's really cool, is not only is it for people trying to avoid joint replacement or not even if that's the conscious thought to avoid joint replacement, but perhaps the thought is, what can I do to reduce my pain and get myself moving better that may potentially prevent me from having a joint replacement done? And because it's the best first treatment option for osteoarthritis of the hip or the knee. But there's no doubt about that. That's what the literature says. But also, optimizing your function before and after joint replacement too. So, long answer to a simple question, and the short answer is yes, absolutely. GLAD is great after having had a hip or knee replacement done too. Cheers.